Hello. Good morning. My name is Shreesha, student of PharmD third year.
Hello everyone. And myself is Jacintha Abisha Angel from PharmD third year as well.
Today in this video, we are going to learn about definition and parts of prescription. So let's get started. When a patient comes to consult the doctor for his or her medical condition, the doctor on basis of the signs, symptoms, medical history, and etc. writes a prescription.
So basically a prescription is a written or computerized order from a prescriber directing the pharmacy to compound and or dispense the medicines for patient's use. Now we are going to see the format of a prescription. This image here will help us to understand that what are the part of prescription and how it looks like. Prescriber office information, date, patient data, superscription, inscription, subscription, signature, renewal instructions, prescriber's signature and registration number. These were the parts of a prescription. So now we will see about different parts of prescription one by one in detail. We will start with the first part of prescription, which is prescriber office information. This part of prescription is needed when the patient becomes ill. Having the information of the physician is vital to being able to reach them in an urgent situation. The prescription contains the following information. First, name of the doctor or office. Second, address with a phone number and email. Third, prescription number. Now we will talk about the next part of prescription, which is date. Every prescription must bear the date on which the particular medicines are prescribed. This must help the pharmacist to keep day-to-day patient's record in chronological order, which helps the pharmacist or a physician to refer the old case in future. To avoid misuse of the narcotic or other habitat-forming drugs containing prescriptions by the patient a number of times for dispensing. Third part of the prescription, which is patient data, includes name, sex, age, and address of the patient. Name, age, sex, and address of the patient must be written on the prescription. Name helps the pharmacist to identify the correct patient, avoiding any chance of giving the medicine to a person other than the one it is dispensed for. Age of the patient becomes important in the case of pediatric and geriatric cases because the dose of the drug in such cases varies due to their differences in the ability to metabolize drugs. Hence, dose of the drug are calculated based on the age factor in such cases. Sex or gender of the patient also plays major role in the prescription because dose of drug may also vary based on the sex or gender of the patient, as their abilities to metabolize or response towards drugs may vary in many cases. Address of the patient is generally recorded to contact the person at the later stage or to deliver the medication personally. Fourth part of prescription is superscription. This part of the prescription is represented by the symbol Rx. In the ancient times, it is considered as a prayer to Jupiter, the god of healing, for fast recovery of the patient. Nowadays it is used as abbreviation for the Latin term take thou, which means you take. Fifth part of prescription is inscription, which is considered as the main part of the prescription. It contains the name of drug, quantities, and dose of the prescribed ingredients. The medication may be either an Official or non-official preparation. Official preparation, where the name of the preparation is the only thing written, which means the base, which is the active medicament, the adjuvant, which is the substance added to increase action of medicament. The vehicle is a substance used to dissolve medicament. Non-official preparation. In this, each ingredient's quantity and preparation type will be specified. Sixth part of the prescription is subscription. This part of the prescription contains directions of the prescriber to the pharmacist regarding the type and compounding of dosage form, along with number of doses to be dispensed. This is important because dose of drug also depends on the type of the dosage form. Seventh part of prescription is signature. This part of the prescription contains directions to the patient regarding the administration of the drugs. It is generally represented as sig on the prescription. The instruction may include the quantity to be taken, the frequency of administration, the mode of administration, the special instructions such as dilation direction. Eighth part of prescription is renewal instruction. In this part, the prescriber check whether the prescription can be renewed or not. It also should include the specifications like how many times it can be renewed. It is of utmost importance in case of narcotic and other habitat-forming drugs. Ninth, and the last part of prescription is prescriber's address and registration number. All other parts of the prescription may be printed or typewritten, but the prescriber's name must be handwritten and should be signed. This eliminates the danger of dispensing medicament on spurious order, and it authenticates the prescription. The prescription containing narcotic or other habit-forming drugs must bear the address and registration number of the prescriber. This identifies the special license which a prescriber must have to prescribe the narcotic and other habit-forming drug. There are two types of prescription. First, the compounded prescription, and second, the non-compounded prescription. Compounded prescription is an order that requires mixing of one or more ingredient. It contains several ingredients, which are divided as base, adjuvant and vehicle. Non-compounded prescription, it does not require compounding of pharmaceutical products. Pre-compounded drugs supplied by a pharmaceutical company by its official name. Legal requirement for a valid prescription are: prescription should be written in indelible ink. Prescription must be signed in indelible ink by the practitioner using his own name. Prescription must be dated by the prescriber. Prescription should state address of the practitioner. If issued by a dentist, the words for dental use only. Prescription always writes legibly. Prescription always space out words and numbers to avoid confusion. Prescription always contains complete medication orders. Abbreviations used in prescription are AC, anti-kebum, means before meal, BID, bis and die, means twice a day, GT, gutta, means drop, HS, hora somni, means at bedtime, OD, ocular dexter, means right eye, OS, ocular sinister, means left eye, PO, paros, means by mouth. PC, postquebum, means after meal. PRN, proranata, means as near. Q 3 hours. Ka 3 hora, means every 3 hours. QD, kakdis, means every day. QID, quaterndi, means 4 times a day. SIG, signa, means right. TID, terindi, means 3 times a day. Convention for avoiding ambiguity. Over years, prescribers have developed many conventions for prescription writing, with the goal of avoiding ambiguities or misinterpretation. These include careful use of decimal points to avoid ambiguity, which means avoiding unnecessary decimal points and trailing zeros. Always using leading zeros on decimal number less than 1. Directions written out in full English. Quantities given directly or implied by the frequency and duration of the direction. Where the direction are as needed, the quantity should always be specified. Where possible, usage directions should specify times rather than simply frequency, and especially relationship to meal for orally consumed medication. The use of permanent link, writing out a number as word and numerals. The use of apothecary, advertise units, and symbols of measure is discouraged given the potential for confusion. The degree symbol, which is commonly used as an abbreviation for hours, should not be used since it can be confused with a zero. Micrograms should be written as mcg. Now we will talk about who are eligible to write prescription, legally qualified and registered medical practitioner like MBBS, MD, MS are only eligible to give prescription to their patient for managing the illness. In some countries, certified nurse may also issue prescription with prior permission or the verbal instruction from the clinician. In some countries, licensed certified physician assistants, optometrists, and clinical pharmacists are also eligible to write the prescription. However, medical students are not eligible to give the prescription. Now we will discuss some MCQ questions on what we saw till now. A prescription becomes a legal document once signed by a registered medical practitioner. True or false? The date on prescription tells us A. Date of writing prescription. B. Date of the presentation of prescription. C. Name of patient. D. Both A and B. The term Rx means A. You take. B. Avoid this. C. Purchase this. D. Dispense this. The term Rx is written in which part of the prescription? A. Inscription. B. Superscription. C. Subscription. D. Signature. Which of the following is not a part of prescription? A. Inscription. B. Superscription. C. Signature. D. Downscription. Inscription is also called as A. Eyes of the prescription. B. Head of prescription. C. Body of the prescription. D. Hand of the prescription. Instruction to the pharmacist were written in which part of the prescription? A. Inscription. B. Superscription. C. Subscription. D. None of the above. In prescription along with name, age, sex, sometimes weight of the individual is also written to A. Identify the individual. B. For calculation of dose. C. Identify the prescriber. D. Both A and B. Answers of the discussed MCQ. At last we, B. Shreesha and S. Jacintha Abisha Angel, thanks you for watching this video. Hope it was informative.